Okay, my goal today is to help those who so wish to reduce their chances of getting pregnant as much as possible, and this will reduce the rate of unwanted pregnancy and abortions. Now, granted, there is no 100% guarantee that this will prevent pregnancy, but we can get close to that 100%, and there are several methods with their advantages and disadvantages, and we will not be able to exhaust all of them in detail in this short video, but briefly we can only look at 6 simple but very effective ways of preventing unwanted pregnancy. Hello, my name is Dr. Malik King, and do well to subscribe to this YouTube channel for free health and wellness videos. First, there are many myths and ways out there that don't actually work, and I don't have the time or even the patience to start addressing them. But drinking salt water immediately after sex or rushing to wash sperm off your vagina immediately after sex doesn't prevent pregnancy, and there are several other myths around we can't address. So what exactly works? Number 1, no sex or abstinence. A very powerful alternative to sex is abstinence from sex, and of course it is 100% safe. But note that lack of sex does not kill, neither does it have any negative effect on your health, nor in your mind or your body. But married folks wouldn't want to depend on abstinence for a long time so you don't affect your marriage negatively. Abstinence is an option, say when she's ovulating, and there's a high chance of becoming pregnant during ovulation, so you will want to abstain for that short period. Number 2, calendar method. Now, calculation of your safe period is a very good place to start in preventing pregnancy, especially for women with a fairly regular menstrual cycle. That is to say, you see your period about the same time monthly, with only a few days plus or a few days minus. Now, simply put, if we call the day you started menstruating day 1, the day you started, and 8 days after you started menstruating, day 8, then avoid sex from day 8 through day 19. Every other day is safe, including the day you menstruate. Typically, that is day 1 to day 7 is safe, and then from day 20 after the commencement of your menses to your next menses is also safe. So generally you are avoiding days around day 14, including day 14. Now, this doesn't work for some women, especially for women with very short menstrual cycles, say 21-day cycle, or very long days of bleeding, say they bleed for 7 days. This method of calendar method or say calculating of safe period is not effective for them because the probability of being wrong is relatively high, and they could get pregnant even while still menstruating. So take time to study this method and also study your cycle. It is not just cheap, it is free and very effective, and I've done several videos on how to calculate your safe period and ovulation period right on this channel, and you can check them out. Also check the description section below for links to these videos. Number 3, withdrawal method. Now, even though some religions and religious denominations forbid these, this is not a theological platform, so you choose the method you are comfortable with and that fits in your belief system. Now, the withdrawal method is simply taking out the penis just in time before ejaculation, before releasing, and it has been proven to be quite effective if done correctly. This, however, requires skill and self-control from the man, but some men complain that it actually obstructs the flow of the whole process. Well, that's understandable. Now, the man must be experienced to know when he is about releasing, and it does take some practice to get this right, even though an accidental discharge may mean pregnancy. Also, it is important to note that some whitish sperm-like fluid comes out before the actual release. This doesn't usually contain sperm cell, even though it may sometimes. It is for lubrication. Now, failure in the withdrawal method preventing pregnancy usually comes from being carried away and not coming out well in time. before releasing. Failure also comes from going for another round of sex after releasing, and some semen may remain within, which can only be removed by urinating. So in summary, for the withdrawal method, come out way before release and urinate to clear the pipeline before going in for another round, which is usually not advisable. Number 4, condoms. Now, we all know about condoms, but people, especially men, complain about how it reduces sensitivity. Yet, it has a high percentage of effectiveness if used correctly, and it also prevents some sexually transmitted infection. It is cheap and it prolongs intercourse, helping men to last longer, especially men with premature ejaculation. Now, failure comes from condom breaking or slipping off during or after intercourse. Do well to check the expiry date to make sure it's not an expired condom. Don't lubricate the condom with Vaseline or baby oil. Rather, go to a pharmacy and get KY jelly or any water-based lubricant for lubricating the condom if you must, and make sure she is well aroused before penetration to prevent pain. And don't forget to allow for some space at the tip of the condom so you reduce the risk of breakage. And make sure you come out before the penis becomes too soft by holding the base of the condom while you carefully come out to prevent spillage. And don't use condoms more than once. In case of a breakage of the condom or spillage of semen, get an emergency contraceptive immediately. Number 5, pills. I wouldn't say much about contraceptive pills and other hormonal contraceptives like implants. For details, talk to your doctor or visit the family planning clinic in any big hospital close to you. Pills are among the most effective ways of preventing pregnancy, but for the side effects like weight increase, menstrual problems, increase in blood pressure, and so on. Now, emergency contraceptives like Postinor are very effective in preventing pregnancy if taken within 72 hours after sex, and as usual, the earlier the better. And if you vomit within 3 hours of taking the tablet, take another one. And note that emergency contraceptive doesn't prevent or protect for subsequent sex. It may, however, affect the next menses. 1, in timing. It may come earlier or later. Or 2, in volume. It may be heavy or scanty or not at all. Now, I've done few videos on Postinor and emergency contraception, and do well to check the description section below for links to those videos. Number 6, intrauterine devices. Now, an intrauterine contraceptive device, IUCD or IUD or ICD or coil, is a small, often T-shaped device that is inserted into a woman's womb to prevent pregnancy, and they can work for several years effectively. Among the birth control methods, IUDs are one of the best. They are very effective even for people who have never had children before and are not ready for one at the moment. And the beauty is that once removed, even after several years of use, fertility returns to normal immediately. While copper IUDs may increase menstrual bleedings and result in more painful cramps, hormonal IUDs may reduce menstrual bleeding or stop menstruation altogether. Now, talk to a medical person if you have further questions or concerns concerning pills or concerning any of the method of preventing pregnancy we have discussed. Did you learn anything new today? Don't forget to hit the like button and stay subscribed, and check the description section for a free ebook titled Fire Your Doctor. Take charge of your health and happiness.